pandemic and ongoing struggle of institutional racism. To get the format started, I want to be able to provide those of you who may not be that familiar with the Association of Black Psychologists a brief history. Following that history, I'm going to just acknowledge an activist that we lost due to the COVID-19 pandemic, and then begin to introduce the panelists and begin the questions and responses that they have. And hopefully there'll be an opportunity to also have each of you who are participating on Facebook to lend your questions, which will go through the chat box and be channeled to me to share with the members of the panel. So without further ado, let me begin to share with you the history of the Association of Black Psychologists. And I do this as I'm also currently serving as the national historian for the Association of Black Psychologists, also having served as a past national president. In 1968, a group of early, mid, and seasoned career psychologists and students took a decisive stand to change their professional engagement with the American Psychological Association, or APA. This monumental decision was born out of longstanding struggles, resulting in a conscious awareness that we must define our own reality as Black psychologists and establish solutions necessary to confront the vestiges of individual, systemic, and institutional racism and psychological oppression. So over the past 52 years, the Association of Black Psychologists did exactly this by establishing an organizational platform that supports culturally relevant ideas, scholarship, research, practice, and to ensure the Association of Black Psychologists has energized women and men towards an activism that continues to transform the field of psychology nationally and internationally. There are many contributions that have been made. I just want to share a few of the contributions over this 52-year period of history. Our decisive engagement, for example, with several amicus curiae briefs, establishing legal changes that have impacted issues revolving around biased educational testing, addressing the gross inequities to Medicare and Medicaid coverage affecting Black patients in public mental hospitals, addressing fairness in housing issues, and addressing educational decision-making issues. The Association of Black Psychologists has also been decisive in generating instructional programs, policies, and venues. For example, we have one of the most highly rated journals in the Journal of Black Psychology. We also have established a newsroom titled The Psych Discourse. We have consulted with and collaborated with many civil rights organizations and partnered with other organizations, as well as work that we continue to do with the Congressional Black Caucus. And we've also provided a platform to address the cultural and psychological issues impacting the prison industrial complex, mental health initiatives, cultural competencies for disaster relief first responders, and creating an emotional emancipation circle, which establishes healing within our communities, just to name a few. And finally, the Association of Black Psychologists membership has collectively spearheaded disseminating evidence for our rich cultural and historical past while informing current and future generations of the value and importance of acquiring knowledge of self as the counterbalance of efforts to write off and damage our humanity and wipe out our existence. Consequently, the Association of Black Psychology membership is engaged in efforts to heal our people, a people who have endured and survived the trauma of human trafficking or enslavement, Jim Crow era practices, illegal statutes, lynching, long-standing racial discriminatory policies and practices, all of which have given rise to generational disparities and social and legal inequities. Therefore, the Association of Black Psychologists is our platform as Black psychologists to discuss key issues that by experience, knowledge, and familiarity, we are proficient to examine. The ABPsi for the past 52 years has been an organization informed by an awareness of the essence and spirit of what it means to be human, Ubuntu. As such, when you look at our vision and mission statement, it pretty much goes like this. The ABPsi sees its mission and destiny as the liberation of the African mind, empowerment of African character, and enlivenment and illumination of the African spirit. And in many ways, that sets the tone for where we are today with this fitting discussion, mental health activism during the global COVID-19 pandemic and the ongoing struggle of institutional racism. Now, for those of you who have invited others on and you may be wondering, like, should I sit my recording to record? The Association of Black Psychologists is using our association Facebook site to record this for posterity purposes so you can look at it later. We also invite you, and when the opportunity presents itself, to participate in our ABPsi Instagram and Twitter. At the same time, I want to invite you to further your interest, especially if you're in the field of mental health and psychology, to check out our website and to read our psych discourse, to use our Journal of Black Psychology as an instrument of study and information for you, and to reach out to chapters near you in terms of membership. This now brings us to the most exciting part, and this is where we begin to introduce our guests who are going to be on the panel. But before I do this, I think it's important that we remember that over the past 52 years and even before then, that our interests and desire to make a difference was a result of remembering our ancestors and remembering those whose shoulders we stand upon. And as such, over the past few months, we lost in the DC area one of our activists, Dr. Gulati, a psychiatrist that worked very closely with many of the works that we had. And I'm sure there are probably others. And so as we move forward, we should all remember them by continuing to do the work that they do. So here we go. I am proud to be the moderator. My name is Dr. Benson Cook, past president of ABPsi and currently a professor of psychology and counseling at the University of the District of Columbia. As our guest, we are honored to have Dr. Theopia Jackson, professor at Staybrook University and our current national president for the Association of Black Psychologists. We also have Dr. James Savage Jr., CEO and founder of Institute of Life Enrichment, and also a past president of the Association of Black Psychologists. We also have Dr. Fia Mbilisaka, a clinical psychologist and a professor also at the University of the District of Columbia. And we have Dr. Satara Streeter, founder and executive director of Ascension Psychological Community Services, and the Reverend Dr. Anika Wilson-Brown, senior pastor of Union Temple Baptist Church. So as I stated before, the way we want to get this going is I'm going to introduce some questions. I'll start off with the first question and I'll take it from person to person. The question is, how do you, generally speaking, or within your practice, reach out to the community to address issues of disparities in healthcare during the pandemic and social justice concerns around policing? And this first question goes to Dr. Theopia Jackson. And as I ask this question of you, Dr. Jackson, I'm really interested in how you would address this as the current national president, using as an instrument an association that not only is national, but international, with chapters coast to coast, border to border, the Caribbean, South America, Europe, and elsewhere, and Canada as well.
Thank you, thank you. First and foremost, Hotep family, thank you for having me here. This is a blessing. I want to appreciate both my past presidents who are here, from whom I'm still learning, and appreciate the work that you've done, and honoring the DC chapter under Tony Camp's leadership for putting this together. And of course, I want to celebrate my colleagues who I'm on here with. This is going to be quite an experience. It's a treat for me. First and foremost, I want to also pay attention to the title here, this idea of activism. And when we think about activism, it gets conceptualized as an intentional action with the goal of bringing about social change, or an activist can be considered as someone who is fighting for change in society. I bring it up because I would submit to you that the Association of Black Psychologists exists for that exact sole purpose. Before it was popularized to use such terminology as social activism, the social change and equity, we've always been doing this work because of the mission statement we have, which is trying to be very clear about who we are and defining ourselves for ourselves based on our cultural history and knowledge and ways of being versus someone else doing it for us. So of course, I would be answering this question from the space of what's happening with the Association of Black Psychology. In doing so, there's a number of different things. We're experiencing one right now where our chapters have very much so stepped into the virtual world to bring our message forward and to engage people all around the world, particularly our international members, around this critical question of how are we doing in the midst of these two pandemics, which is COVID-19 and 16-19 pandemic. And we are engaged in conversation that allows us to draw upon our own tools for coping and dealing with this and reminding our people of who we are and grounding us culturally. What I mean by that, some of the webinars have looked at how do we bring in rituals for addressing the grieving and loss and celebration of life when the body is not available to us. As a reminder, this is not the first time someone has denied the bodies of our loved ones to us. So we have that clear way, rituals of honoring that. So we've been engaging our community to remind them of those things in doing it. Also, we continue to be collaborating with other Black-like organizations, particularly under the leadership of the Black Family Summit. And we're doing things like our Ubuntu healing circles with the Community Healing Network, which is our partner around the emotional emancipation circles that they envisioned and so graciously invited us to help to bring to reality. These circles are happening all over the world. So understandably so, we have converted these emotional emancipation circles into virtual healing circles that we call Ubuntu within our CHN partnership, or with ABPsi, we have those that are called Sawabono. And just to be very clear, these are meant to be rapid response to the acute stress that we're sitting in, first with the COVID-19 and now with the extra layer of the 16-19 pandemic. So this allows us to offer this to our people around the world to help ground and settle and deal with this in front of us. We also have our chapters that have been partnering again with members like the Institute for the Black World's Black Family Summit. We're in New York. I want to give a shout out to our New York chapter under the leadership of Jamila Coddington and others, that they have launched what we call Listening Lines Initiative, which is to allow for people to sort of call in, particularly those who are first responders dealing with the agitation and trying to manage the emotional and psychological trauma that they're experiencing during these pandemics. And this is meant to be a model that's going to be replicated across the country. So that's a sampling of what we're doing at that level. What I would also like to say too, in terms of looking at this issue of police violence, first and foremost, it's clear to me and clear to all of us that what's happening with the police violence is only one example of the complexity. So we can't focus only there. We have to make sure we are dismantling white supremacy and ideology in all the places that it exists because of the impact it has on Black minds and bodies. But with regard to this issue, not only has ABPsi reactivated, relaunched its work around how do we better serve the needs of incarcerated persons, but how do we also enter into this critical conversation around police reform and or defunding. So those task forces have been launched again, and we will once again partner globally with those who are like-minded, because in the spirit of Ujima, this collective work is massive and important. And I would also draw the audience to the statement papers as well as call to action that we posted on our website and disseminated immensely. We ask you to help get the word out as well. And I'll close by saying too that the board is entertaining a proposal now that's called the 10-point Black Recovery Plan that includes the issues around police reform as well as other spaces. And when we think about police reform, I do want to give a shout out for our Black family in blue, because we do have those who are, quote, wanting and trying to do the right thing, but they too are sitting in a system that does not see their Blackness and intentionally they will retaliate if they were to take a certain stand. This feels familiar to me as a licensed clinical psychologist sitting in the field of psychology within the American Psychological Association, where there are some systemic oppressive ideologies in here, and there's not room or space or voice for me to bring forward to kind of affect change and dismantle that system. I'll stop there to allow my panelists to join.
Okay, this is very good. I'm glad you spoke to the issues you did, because you remind us that this is a conversation. I'm fortunate to moderate this conversation with all of you, but I think the community is going to be benefiting from participating in this conversation, albeit virtual. After listening to you, I want to kind of move to Dr. James Savage, kind of around the same question. Now, Dr. Savage, what is important about your work is you have created an institute that provides services in 2 different states. Could be more places, but I know Maryland, Columbia. And as such, my question would be, with regards to this question, how do you address that same question, which you generally or within your practice reach out to the community to address issues of parties and healthcare during the pandemic and social justice concerns around police? Dr. Jim Savage, is he there? Okay, you have to unmute your mic. Unmute your mic.
Okay, I did.
Okay.
Yeah, I didn't hear you clearly because you were breaking up a bit on my end.
Okay, let me just kind of, because of the work that you do, where you've had practices across state lines, you've had treatment facilities in Maryland, in DC, you've done work in other locations. How would you address this particular question? The question being, how do you reach out to the community to address disparities in healthcare, especially during the pandemic, and also dealing with clients that you may have that are also struggling with the social justice concerns around policing?
Well, let me say that the Institute for Life Enrichment has been in this mental health business for the past 41 years. And we've had a lot to say and do about the disparities that we see in mental health, which is plenty. And we, I should say that with 3 clinics, 2 in Maryland and 1 in DC, and we do have a nonprofit that I help with my granddaughter to run in Virginia. So we sort of operate across, 3 states. And what we see is that we have 2 medical directors that I have to communicate with. We have 3 program managers, and I have to communicate with them as well. And we have to interface with our administrative staff. We have to also deal with our clinicians, which we have about 30 clinicians that we have to supervise. And we are doing our best under the conditions that exist now, because the states have really relegated us to just telemedicine, telehealth per se. And so we are connecting with our patients mainly by Zoom and by telephone. And hopefully we will begin to do face-to-face again very soon, hopefully. But until that time, we will continue our telemedicine, telehealth. Now, personally, I see only a few clients myself. And with them, I do Zoom, I do telephone, I do text, and I do email. And I try to deal with the issues that they're dealing with now, which are plenty, because they are very anxious about this COVID-19. They have seen death and dying all around them. And this has been a real what can I say, a very, very depressive time for many of our clientele across Virginia, Maryland, and DC, because we have been hit hard by this COVID-19. We've seen death, right? And you mentioned one renowned psychiatrist that we lost, and that was Dr. Elise Filati. And there are many more that in terms of people that we have lost. And so the grieving is heavy. And so we are doing our best to deal with grief. It's easier to deal with when you're doing it face to face as it is doing it over the phone or over the internet. But we are doing our best, and we'll continue to do just that.
Given what you just said, it makes me wonder, will there be a need for the Association of Black Psychologists in general, and Black psychologists more specifically, to develop cultural strategies that use this virtual technology?
Well, I'm hoping that, I mean, telemedicine I was dealing with when I was on the board of psychology, and as chair of the board, I was trying to help make telehealth or teletherapy something that we could do across state lines without any type of checks and balances, as far as once you get one license, you could do it in multiple states. Mm-hmm. And I think that we did talk about, some of the cultural aspects of it, and we did get, we never did get the licensure or the cross-state licensure, the interstate licensure going for this psychotherapy. But I do think that the Association of Black Psychologists could play a part in that, and I think they could partner with the Association of State and Provincial Boards of Psychology, and they tend to deal with licensure in all 50 states and the 10 provinces of Canada. And so I think if ABPsi could, partner with the APB, I believe, that they would be able to maybe make a change in terms of trying to bring some cultural benefits to this whole field of telemedicine.
Okay, thank you. I want to, based upon what was said, I want to take this next question to Dr. Afia Mbalashaka. Dr. Afia Mbalashaka, you do a lot of community psychology work. Yes, you have your clinical practice as a licensed clinical psychologist. And I know you've dealt with issues that impact how we see ourselves around the psychotherapy in terms of the image of hair. And not, it's more than just an image. It's impacted some young people's education, as the Crown Act has been an effort that you've been championing nationwide at various state government places. After listening to Dr. Savage, though, how do you deal with low wealth populations, for example? And then I'll get to the question more specifically. I know that your work before COVID-19 was barbershops, beauty salons, other community places where people kind of congregate to kind of do the work that they do, who may not have access to the kind of technology that would be necessary to be able to do, the kind of telework that we're having to find ourselves do more of. So the same question to you, based upon what you do, how do you reach out to the community to address disparities in healthcare during the pandemic while addressing the social concerns around policing?
All right. Well, wonderful, complicated question, Dr. Cook.
Yeah.
I do want to thank everyone for meeting today and having this intense conversation that's so needed for our community and on this platform. I think as a cusp millennial clinical psychologist, I really do lean into social media. So although maybe not everybody has a desktop or a laptop, most people do have cell phones. And I think one of my mediums has been Instagram over the pandemic, in terms of having lots of live streaming discussions between community members or other psychologists. And even with some of the hair care work that I do, I've been doing more virtual trainings with barbers and hairstylists and basic counseling techniques. So you were identifying my work as psychotherapy, and basically that's using hair as an entry point into mental health services. And so over the past few months, I've been doing programs online, whether through webinars or Instagram, related to emotional first aid. So just like we have, CPR trainings, that I've been holding these emotional first aid trainings so that community members can now utilize some of the skill sets on themselves and other people. I think there's a limitation of Black psychologists, right? We're only about 4% of psychologists in the US. And so I've been seeing my mission over the past few months, both in the health pandemic and the racial pandemic, and even gender and sexual assault pandemic, to really train and arm people with the skill set to address their own needs and the needs of their community. So I definitely utilize leaders in the community that I've identified as hair care related leaders to be able to implement some of this work. And as you know, there had been a lot of unrest even in white communities about access to barbers and salons. And so with some of them opening up, that they are now the first contact that some people are having after months. And so I especially see their role as being very important now. So so my response in terms of leaning into social media in particular as sort of a self-guided form of communication, so people can actively engage in conversations outside of traditional institutions or just private practices alone.
I want to add something else that I've seen you do. You have an Instagram account, and
Yep.
I was very pleased when I think it was an HBO special that came out that talked about Netflix. Okay, speak about that.
Okay, so I'm not sure how many people saw the Self-Made on Netflix by Madam C.J. Walker, but they really dishonored our ancestors. And I was so disappointed and shocked as a hair historian how incorrect and the level of scientific colonialism, as Dr. Wade Nobles would call it, that was in media. And I know media can manipulate, but it was just so wrong. So one of the approaches that I took in watching that miniseries was to critique every single episode through a video. So what I would do is would fact check it. Well, it was kind of complicated. I would get dressed up, do a different hairstyle each day, record myself watching it, and then go through my books that I have on the history of Madam C.J. Walker, or, her history is so expansive, including W.E.B. Du Bois, including Booker T. Washington, including other, major figures like Ida B. Wells and the anti-lynching campaign, because we oftentimes don't include Madam C.J. Walker as an activist. But she funded the UNIA. She funded Pullman Porter. She funded all of these major movements. So I went through each episode to identify the historical information and activism of Madam C.J. Walker, and recognizing not only was she, the first Black female millionaire, but she really changed the social landscape of Black people in this country through image, and beauty. But of course, she really pushed economic gains, and even was huge in real estate, all these different things that we don't necessarily know about. So I definitely leaned into my social media to be able to broadcast it to a way larger audience than would have been possible if I was just giving a lecture on it at my university. So I do appreciate that space to have intellectual criticism and conversations through Instagram in particular. I started Dr. Cook's Instagram account, so I need to update it for you. We need to have
I actually need that updated. Okay. and I'm glad you shared that, because it's important for the audience to know that we are capable of defining our reality in ways that often require that we kind of step up to the things that we see that need to be changed. And that was something you took on yourself. No one had to invite you or ask you to do that. And that's a part of what speaks to the vision and mission, the enlightenment and enlivenment of our community. And in many ways, this kind of gives me a really nice segue to Dr. Satara Streeter, founder, executive director of Ascension Psychological Community Services. But let me kind of break it down for those who may not understand. And Dr. Streeter, you can correct me after I say this if I'm incorrect. This was a sister, Dr. Streeter, who saw the need for there to be a clinical services in the District of Columbia for young African-American girls and young women that did not exist, and used her own space initially to establish a center, after which now she has a thriving organization that really not only works with people who can come to this location, but goes out to the community to ensure that they know that they have a voice, although they may feel voiceless when overwhelmed with a number of emotional challenges and issues, or challenges that may be the result of dysfunctional families that are the result of oppression. So, Dr. Streeter, if you could kind of speak to this same question and frame it within the context of the work that you have done and continue to do, we would like to hear that. Again, how do you reach out to the community to address issues of disparities of healthcare during the pandemic and social justice concerns around policing? Dr. Streeter.
Okay. Thank you so much for that, Dr. Cook. I'd be remiss not to start with how grateful I am to be on this panel and how I'm able to view you all in this moment. And I can definitely say how everyone has had some influence over me as a woman in my career. Dr. Savage gave me one of my first jobs out of grad school, where I came and did testing over off of Georgia Avenue for a couple of years. And I was so grateful to be able to be in that space because my main job was at a special education school where children were not being poured into. So to be able to see Dr. Savage and kind of be up under him has been wonderful. Dr. Cook, our experience together in ABPsi, and then you being one of the ones that introduced me to Union Temple Baptist Church, where Reverend Wilson Brown is now, and how Union Temple poured into me, how Dr. Cook has poured into me over the years. My soror, Ethiopia, Dr. Ethiopia, and her wonderfulness, and always having an encouraging word. And then to be able to see our younger generation, Dr. Afia, being able to go out and go into the community and do all these things, and not just take therapy, in the room and in the confines of people who are like, oh, let me call and get some therapy today, but basically reaching out to let them know that therapists look like us, therapists, talk like us. And this is I'm just extremely honored to be here with you all. Thank you for acknowledging the work that I've tried to do over the last 16 years. I did, in fact, start Ascensions in my living room. I used to live across the street. I've moved about 10 minutes away, but I used to live right across the street from the Deanwood Metro Station. And at that time, as soon as I got licensed, I knew I wanted to be, working in my community. And I set out to find a office space in Anacostia. As I said, I was going to church there, and all my friends was there, and it was close to my house. So I went out to start getting panels so I could accept Medicaid and Medicare. And people said, oh, it's going to take a long time for you to be able to get paneled and serve the people. And even when you do get paneled and are able to accept insurance, Black people don't come to therapy. So you're going to be out of business soon. And these were things I was hearing, across a lot of spectrums of the people that I was talking to at the time. And what happened is I started filling out those applications for insurance, and I would say in 2 or 3 weeks I got accepted, and people started calling and saying they needed therapy. And I couldn't say, oh, I don't have a space yet. I need you to wait a couple of months because I need to find some place to see you. And at the time it was just me. So I decided to start seeing people in my living room. So for about 6 months, people would come and they would catch the metro and get off and walk right across the street. And we had therapy together with in the living room. And that's powerful, because so many people say, oh, Black people don't want the help. They don't, they're not going to do therapy. But what I found out was Black people don't like just any therapy. They like good therapy. They like therapy that was created for us, by us. And it was a course through the Association of Black Psychologists, who I started to interface with in 1999 at my first conference, that I learned how to be the psychologist I am today. So I'm forever grateful. In terms of the work that we have to do now, we have to, like Dr. Afia said, we just have to be in the community. We have to be where people are there to be able to access us. Like Dr. Wilson Brown in her ministry, she's there, she's accessible, she's where people can touch, where people can talk, and people know she's a real person and she's not just making up stuff to get them to their liberation. She's gone through it, she knows some things. So we have to be those people. We have to be able to touch. Like I always say, that I don't really, of course I say these are my clients, but what I know is this is my community. I am doing this therapy that I'm doing because this is all of us. This is not something I just go to do with some people. If I'm able to help and liberate my community, then that's going to be better for all of us. So that's going to be better for my 2 children coming up in Southeast. That's going to be better for all of us to be able to get through these times that some of us thought were far behind us. Some of us thought we were done with this after 1968, after 1975. But right now, we know that we're still in the thick of it. So we as psychologists have to be here. We have to be available to continue to do this work. And it's been difficult because I had, over the past 16 years, people have said all the time, well, Dr. Streeter, will you, do you do telehealth or can we see you online? And I'm like, absolutely not. I need to feel your energy. Like I spend a lot of time like with aromatherapy in the office and picking out the right type of jazz to play with people. So I see therapy as an experience. So I never thought that I would be sitting here like this, having to talk to people. And it really is important for us and for the Association of Black Psychologists to help with what are the rituals that we can do surrounding this to be able to bring spirit in the room and still connect. And that's been the process over the last 3 months of figuring out. And I think we're getting there, but we definitely need ABPsi to help clinicians to be able to do that. So it won't be that just stark, cold therapy that all of us are running away from, because that's not what works with our people.
Outstanding, outstanding. And of course, this leads us to Reverend Dr. Anika Wilson Brown, Senior Pastor, Union Temple Baptist Church. I remember when I first came to the DC area, Dr. Naeem Akbar told me I needed to go to Union Temple Baptist Church. And I went there. And at the time, Anika, your father was there, senior pastor. And since then, you have brought in the next generation of that rootedness that makes us uniquely who we are. I think Howard Thurman said it best when he said, we're really spiritual beings on a human journey, not human beings on a spiritual journey. And as Wade Noble says, with an African face. But in that context, Union Temple Baptist Church has a broad array of ministries that connect with the Black community in a way that I've not seen in other places, impactful as it is there. So also, and I want to acknowledge the fact that the last anniversary of the Million Man March, you stood up at the podium and you spoke so eloquently to the issues that impact us. And it's almost like you could take that speech you gave then and kind of put it in the context of what's happening right now. It's like nothing has changed in terms of the struggle. So I'm really interested, we are really interested in hearing how you address this question based upon the work that you have done and continue to do about how to reaching out to the community to deal with those issues of disparities in healthcare during the pandemic, and equally, the social justice concerns around policing. Reverend Dr. Anika Wilson Brown.
Thank you so much. And again, I want to send love and gratitude to everyone who has gathered here. And thank you, Dr. Cook, for this opportunity to share. That is a very rich question. There's a lot of depth to that as I think about it, how we've been able to position ourselves within the community has been key. And as a Black church, an Afrocentric church, it's always been important for us to emphasize Christianity as an African religion, to highlight the realization of Jesus as a man of color who was lynched by economic systems and political systems that did not want him to fully evolve and demonstrate the godness that he was in the earth. And so we as people of color, we find ourselves in that same place, in that same position. So if we're going to be followers of Jesus, then we're called to social justice, right? We're called to this work. I love the way Dr. James Cone says it. He says, God is on the side of the oppressed. And so part of my work has been to not only to just speak to the disparities that exist in the education systems and the health systems, but to even speak to those disparities that exist within our religious systems. You know, so I stand at that intersection of being a faith leader and being a counselor. But I think it's very important for us to continually engage in this process of decolonizing our faith, you know, which is really to rid ourselves of every toxic message and system of oppression, even those, you know, that exist within our churches. And so our work at Union Temple has really been about examining those toxic religious messages that have really been damaging to the African-American psyche, right? So that we all recognize ourselves as divine beings. And so our work has been about helping individuals to see themselves as divine, to see themselves, you know, despite, you know, the elders would say, you know, no matter what happens to you out there, you still a child of God, and, you know, you still hold your head up, right? And so that has been our position in our work in the community to help people to stand in that power. And it's even more prevalent right now because of what we're dealing with the COVID-19 pandemic and the resurgence of a lot of these racial triggers, right, that have always been there, but are now coming to the surface. So a lot of the work that I've been doing is I keep getting the question, where's the leader? You know, where we had a Martin Luther King and, you know, we had all of these great leaders that kind of led the movement. Now I feel like part of our healing on a mental health and spiritual level is recognizing that we are the leaders, that we are the ones we're waiting for. So a lot of the work has been about empowering people to see themselves as divine and stand in that position of power, to have the courage to face their fears and to face the things that we've avoided as individuals, as a community, and just really wrap ourselves around this notion that it's time for us to overturn every table, right? And to stand in this place of power so that we can really make a difference this time around. So our work is really about identifying these disparities, pointing them out, and giving people the strength and the courage to point them out when they see them and to speak to them and to stand against them and to acknowledge them, even when they exist within their own family systems and even when they exist within their own church communities, you know, to be able to call those things out so that we can begin to eradicate them at all levels.
One of the things that people may not be that familiar with is, as I kind of alluded to, the various ministries. I know that Union Temple Baptist Church has ministries that deal with healthcare. And in those, I've had often an opportunity to discuss mental health. And I'm just curious, how do you see the ministries that you have reaching out to the community that are often low wealth, ignored, ostracized communities?
Yeah, this is more powerful now than ever because the church is what I see as ground zero. It's the place where everybody runs when there's a crisis on any level, educational, health, you know, racial and political injustice. This is the place where people come when they can't get to therapy, can't afford therapy, have still stigmas and shames related to therapy. They'll run to the church. So it's been important for us as a ministry to be that hub and to offer services, programming that is an extension to then direct people into deeper services. So it's important for us to have a farm ministry so that we can teach people how to ground themselves and get their hands in the dirt and tap into these ancestral ways of building. It's important for us to have a health ministry so that we can begin to tie that these health disparities with a lot of the mental and stress issues that we're having. It's important for us to have places of art and demonstration and drumming and creative expression so that those spaces can be healing and give people a place to communicate what they're feeling when they have no other place to go. And so I feel all of our ministries are designed to offer people that depth and breadth so that they can experience the fullness of who they are and heal.
I agree. And I think in many instances, we often historically look to the role of the Black church in creating ministries that have dealt with what you've described, but also dealt with feeding the hungry, housing the people who are homeless, dealing with those who are incarcerated, who are in prison, providing healthcare or directing people to medical support, which is where Dr. Gulati used to also play an important role. And I think that's really important. And that's why what you're saying is so vital. At this point, I want to begin to roll into the next question. And after this next series of questions, or after the next round of everyone responding to this question, we'll go to, I'm beginning to get some questions on the chat box. So the second question that I'm going to kind of roll around deals with how has COVID-19 informed your clinical decision-making to effectively serve African-American client populations? And I start off with you again, Dr. Theopia Jackson. How has COVID-19 informed your clinical decision-making or that of your leadership to effectively serve African-American client populations?
Thank you for that rephrase and restatement, because again, that's where I would be answering from. And I first want again to give a shout out to what's been shared thus far. It is once more a demonstration of the efficacy and the importance of understanding Black psychology and African-centered approaches, because each of my colleagues have spoken about how they have needed to bring that in to the spaces in which and how they treat. And I want to echo what our sister Satira said, that it's not that Black people do not like therapy, they just have to have a therapy that's been made for them. And that's what we're illustrating here. So from the space that I sit, sitting as the president for this international organization, an association, we have reframed how we are organizing ourselves. We're conceptualizing the ABPsi as the cultural first responders, if you will. And the theoretical theme being culturally grounding our people around the world during both these pandemics. And this has shown up in a couple of ways. First, I want to appreciate one of our other past presidents, and elders, which is Dr. Linda James Myers, who provided a cultural framing statement for us. And out of this, again, she's echoing what's been said here, is reminding us that our ancestors gave us everything that we need to do what we're doing right now. It's upon us to reach back and pull that thought process, that language, that the ways of being in the world, thinking about who we are to this space. And for me, what that means is I always have to remember I am Black first and a psychologist second, which means my science is always in the service of my people. This is not, our association does not approach this work from a professional space. We came into this knowing that our charge is to heal, save, and return our people to their righteous minds. And we pull anyone in who is along those same places. That's very different than any other setting, if you will. I also want to give a shout out to Dr. Wade Nobles, who's also a past president and one of our co-founders for the Association of Black Psychologists. In the framing he offered to us was this idea of Zola love, which is a Kakongo construct that was given to us by Tata Fukia, which says that this is a type of self-activating love that embodies peace, tranquility, and productivity. So these two theories have framed our response, if you will, and the way we have actualized it, as I said, is with the virtual healing circles that are going on now. And the intention of these virtual healing circles is as we bring them to the community, how do we also turn them over to the community and replicate? So for example, I'll be meeting with Susan Taylor in her CARES mentor program to see how we can actually offer these circles to the youth in her program and have them be youth-led. And I want to see what comes of that when we give this type of culturally grounded resources to our youth and what they're going to do with it. And one other piece before we move on too is continuing in this idea of UJIMA, which is a collective work and responsibility with our partners under the Black Family Summit. I want to give a shout out to our National Association of Black Social Workers, who were able to create a website for all things COVID for Black folks, so that we're not having to replicate this. So we're trying to work smartly and collectively together. So I want to refer everyone to, and I'll place it in the chat room to share. Not only is there resources there like the documents I'm referring to, but there are also resources specific to each state. And the Association of Black Psychologists, along with the Black Social Workers and the Black Psychiatrists of America, we're going to do a webinar on July 18th that's going to be focused on the state of Black mental health and spiritual wellness. So again, bringing these forces together to sort of demonstrate what we can bring to the table to help our folks heal and be more prosperous as well. I also want to give one small shout out to what has been shared thus far about what's happening in our churches and faith-based. And I know Sister Nika, you would speak to this as well too, is that people of African ancestry are already spirited people, and we manifest that in various ways. And Christianity is definitely one, and we have influenced that, and I want to underscore what you said in terms of how do we decolonize our faith. So I say this to say that as our listeners are hearing this, do not get distracted by the noise and some perception that there's one way of being in terms of our spiritual essence. We are much more complex than that, and we can't let that divide us. What centers us is our Blackness. And if no other time than now, we must find a way to work together and define our humanity together and avoid distractions that separates us.
Okay. Well, one of the powerful themes that I feel is intertwined with your conversation is that as a very diverse Black people, partnerships and collaborations are very important because it allows us to reach out to those who oftentimes fall through the proverbial crack,
Correct.
whether it be due to educational disparities, whether it be due to socioeconomic disparities, whether it be due to geographic. By having the partnerships and the collaborations, each it's kind of like it takes a whole village to raise a child.
Absolutely, absolutely.
All kind of connecting with each other in various ways, which brings me now to you, Dr. Savage, with the same question. You talked about, I think to some degree, how you have seen your clinical decision-making transformed as a result of COVID-19. My question is, how do you see it moving forward to more effectively engage African-American client populations, Dr. Savage?
Well, as I think about COVID-19 and also racism and oppression, I think, both constructs or realities are irrational. And so my thinking and decision-making, it has to do with how do I bring my clientele or the people that I serve into a reality where they can deal with being sane in an insane place or dealing with insanity on a daily basis. Because COVID-19 has no real sanity to it, and neither does racism. So I'm constantly trying to deal with the beliefs and the typical performance of Black people each and every day. And that is to make sure that they are really balanced between the irrationality of, let's say, seeing themselves as invincible, right? As opposed to know that this COVID-19 can kill you. So you don't need to be running out, doing things that are unnecessary that can put you in harm's way, right? And I have young people that I deal with who believe that they're omnipotent. So they're running out there, think they are strong as, as I guess in anything that you could identify being strong, and not recognizing that this virus can weaken you and destroy you. It can, and it can affect your whole body. And so I am constantly relating to the people that I serve in terms of these beliefs and avoiding these behaviors that lead them to do things that are very detrimental. One of the things that I've seen that, we're talking about churches, I noticed that most of the cities and the states closed the churches and left the liquor stores open. Now, I didn't understand that very but then that's part of the irrationality that I'm talking about, right? And so I'm trying to say, please you can't go to church, so please don't go to the liquor store, right? Because that's going to, weaken your defenses in terms of trying to deal with this irrationality, right? And again, I just think that we really just have to wake up to know that this virus, is going to end. It's going to come to an end. I mean, after 1918, we went into the roaring 20s, right? And people having a good time. So I'm quite sure these 20s are coming. So we'll have the 2020s that we might be called roaring too. So I try to deal with my clientele in terms of being patient and not being just being impetuous and going out and doing things that are very harmful. And we saw this, starting with Memorial Day, how a lot of folk, and I saw them of all colors, right, out on the beaches and out having a good time, without masks, without social distancing, and so we're having a problem now. And this problem is going to create a lot of mental health problems, a lot of grief, right? A lot of depression. And certainly there's going to be a lot of anger, a lot of hurt. And so we're going to see people who are going to be brought up on domestic violence charges and child abuse charges. And so I'm trying to just work with our population. And we have a very heavy population of drug users over and especially in our Baltimore area. And so, so there's a lot of weakness there. So we're working very, 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 very strongly and very forcefully in terms of trying to avoid the relapses that some of our people have been really off, been sober for the past decade, and a few of them have relapsed. So we're working very hard. The whole staff is, from the medical directors to the social workers, the counselors, the psychologists. We're working very hard to try to make a difference in terms of this irrational period in our lives. The irrationality of racism and oppression has been around a long time, and certainly with that on that aspect, I know we're going to get a pill or something for COVID-19. I'm looking for us to get a pill or something for racism. And, because I think we need to start looking at the biology of it as opposed to just the psychosocial aspects of it. I'm just throwing that out there.
Okay, I hear you.
All right.
It's interesting. You touched on a number of different points that I made some interesting notes on as a caveat before I go to Dr. Fiabalashaka. One of the points that you kind of identified is how information is so critical. Getting information out to our community is so necessary to inform them and help them to acquire the knowledge, because knowledge is power. Just recently, I saw an article of a sister who had been for some time, I can't remember what university, to get Merriam-Webster to redefine the concept of racism so that it could recognize and cover more of the systemic aspects of what it entails. I recall an article that I read back when I was in college by Dr. Naim Akbar that basically said awareness is the key to our mental health. And in many instances, when I think of the work that you're doing, Dr. Fiambula Shaka, I think of how a lot of your work has been to bring a level of awareness to recognizing that we can appreciate and value who we are and what we bring to the table. At the same time, though, helping us to not just define, but in many instances, redefine self in ways that have us kind of deconstructing what we've been told we are to reconstruct what we know we should be in order to be healthy. And so in that regard, how has COVID-19 informed your clinical decision-making to effectively deal with African-American client populations?
Okay. Well, I want to say that this process has made me realize how ill-prepared I've been as an African-centered psychologist and Black psychologist to deal with what's going on. I think sometimes people in my practice have expected me to have answers to what's happening. And I'm like, I'm Black too. I'm social distancing too. I've had multiple people in my family die from this. So I think that it's caused me to be very authentic, self-disclose, reality check my clients in terms of that process. But I'm really thinking about things that Dr. Streeter was sharing earlier. I was writing down, I'm like, I'm going to post that on Instagram, if you don't mind. But to really think about that there's really a lot of problems in the current state of private practices and just like the whole mental health system. So for example, I know that some of my clients would contact me and say, like, I think I need to cancel my appointments because, I lost my job. And so I'm like, no, this doesn't need to stop because you can't, you don't have an income. Or I noticed for myself during this time, I've had to set a lot of boundaries in not being able to take every single client. People have been referring, I kid you not, I would say I'm getting like maybe 50 requests a week for therapy. I'm like, I'm a sole proprietor. Like I cannot see everybody's aunt and cousin and nephew. And so I've been seeing myself doing a lot of boundary setting because I need to recognize that I have to take care of myself first. I've been thinking a lot about how to be Black therapist centered in terms of recognizing that in order for me to be a good Black therapist, I can't see everybody. Like I would be a horrible therapist if I accepted every client. So I know I'm kind of rambling, but this is all impacting my clinical decision-making in terms of recognizing how I need to be more prepared. So I've been reading more, contacting elders more, past presidents of ABPsi more to get information about how to cope with various crises on a racial and health level. But also, I've been even creating spaces for other Black therapists for us to focus on our self-care. And so I'm realizing that it's not just me, right? In terms of Black therapists are burned out right now. So not only have we been trying to cope with, a global health pandemic, and of course, always been addressing, race and racism, but even now to recognize that we need a lot of love too and self-care. So I think I've been leaning more into my own self-care in order to be able to deliver culturally competent and thorough services. So I'm not sure if I'm answering the question exactly, Dr. Cook, but I know for my private practice that I've, limited the number of clients that I'm seeing, have been very active in referring people, have lowered payments. And the thing that's probably been the hugest change, I don't know about you all, I'm trying to make this more of a conversation, but I actually terminated my lease for my private practice this month. I had been in this office 2 blocks from the White House for the past 5 years. And so I contacted my landlord and I said, I'm not keeping that office because they made me pay a lot of money and I haven't been there since February, but also to recognize that I think maybe I'll start having living room sessions too, Dr. Streeter, but that I'm recognizing that I need to have some alternatives to even how I think clinical practice should look for me going forward, and even the limitations of it. Did I answer the questions?
Yes, you did. Yes, you did. Okay. I mean, you did. This is a very rich conversation, and you're being very authentic and genuine in kind of speaking to the challenges that mental health workers face that some of the participants in the audience on Facebook may not be that aware, that we have to be self-aware of where we are in order to do the work that we do. And so what you shared, I think, really kind of speaks to that in a way that validates what other colleagues might be feeling, but at the same time gives a sense of reality to those who may not really know how it works, which is a great lead in, Dr. Satara Streeter. I mean, you've talked about seeing people face to face. You've talked about the importance of that energy that takes place. Has COVID-19 informed any other aspect of your clinical decision-making in working with African-American clients?
Well, one thing I will say, just as Dr. Afia said earlier, that, only out of all the psychologists in the United States, only 4% of them are African-American. So I decided a long time ago that my practice was only for African-Americans. So hopefully somebody's not watching, sue me for discrimination, but at the end of the day, I don't have time to see anybody but us. There's not enough of us to do this work where I'm spreading myself thin. The other people that I don't see is anyone that would tell me that they were scared to come to Anacostia after dark. You don't need to be at my practice. So I've been very clear about the population that I want to serve and who my community is. But with that being said, seeing all African-American clients, seeing a lot of them that are east of the river in DC, that we were already focused on the things that plague us as a people: anxiety, racism, feeling alienated, health disparities, financial disparities, substandard education, like what we're seeing now with our kids in DC public schools that are not able to get access to all of the things that they really need to be able to be successful in the school, especially now that it's all gone online. This was always our work. So now COVID is just, spread out our work to now more people can see what we've been feeling, east of the river for the last, 50 years. So what it's done is it's just intensified the issues that we were already facing and that we already had. So in terms of informing the work, it just lets me know that there's a lot of work for me to do. I've been telling my clients recently, there's a piece of the revolution for everybody. And I am not going to condemn the brothers and sisters that's going out looting. That's just not where I see doing that. But I see that my space in the revolution is keeping spaces, holding safe space for folks to come and talk to me. Is basically me knowing that this work is hard and knowing that I can't be tired. So yes, I have to take care of myself. So the weekends, I'm spending a lot of time on the water. We recently were given access to a boat that we're able to kind of go out on and just be. So I do that a couple of times a week to just kind of center myself. But I know Monday through Friday that I'm going to have to be in this exact same spot from 8 a.m. oftentimes to 6 or 7 p.m. because our people are hurting and our people need us. So I am just having to find other ways to make sure that I'm taking care of me. But I know that this is my role in the revolution, and I'm not backing down.
Amen. And this really rolls right into the question the way I want to couch the question to you, Reverend Dr. Anika Wilson Brown. I'm not a theologian, but I remember reading something that once said, faith without work is dead. So you got to do the work. I wonder how this impacts you with regard to this question. As someone who's credentialed in mental health, but currently is a senior pastor of a church, during a period of time where we are dealing with a international pandemic called COVID-19, how has this impacted your clinical decision-making combined with your, I'll call it clergy decision-making, to effectively serve Black folk?
Yeah, I am baffled that all of this happened like within months of me becoming a pastor. And I feel like I've been put through the fire.
Yeah.
Yeah, I feel you and what you were saying, Dr. Afia, about this being a moment of true vulnerability and openness. And so I have found myself in response to all that we're dealing with, shedding the perception of perfectionism that is often placed on clergy and those of us who are spiritual leaders or educators or mental health experts, to be in a space where you just don't know what to do and you don't know what is going to happen and how it's going to happen has been a big challenge. And so I have found myself continually shedding the layers of responsibility that say you're supposed to know exactly what to do at all times. And in doing that, I have found that it's been helpful to those that I serve, because it gives them permission to do the same, to kind of shed some of the weight of having to know everything, having to know what to do in every moment, and just giving space for that vulnerability and transparency and freedom. So we've been bringing that into our practice because we can't come into church. And so we've been doing things like groups. I've been bringing in clinicians and doing Facebook check-ins and chats and having folks send in questions and having conversation around those feelings and emotions that they're experiencing. And then on a ministry level, we found ourselves doing more feeding than ever. We have a quilting ministry that's been making more masks and giving them out. And we've provided many laptops or iPads to our elders because they couldn't participate in worship. They couldn't participate in any of these mental health chats or groups that we were doing because they could only talk on the phone. So it's been also about identifying the needs and trying to fill those gaps as we move along to meet the specific needs that are in our community. So that has been our unique response: transparency, along with just trying to be where people are, be present with them, and provide them whatever support we can.
From what you just shared, I'm wondering, have you gotten feedback from the community to get a sense of how much this new transitional process has been valued?
We have been checking in, and people have been really saying that it's interesting that all of the programming and outreach that we've doing has helped them to feel even more connected, even though we're distanced from each other, which is interesting. But I still feel myself challenged to try to figure out who are the people that we are just totally missing. Like, who are the ones who just have no Wi-Fi? And I just feel that we have to figure out a way to really truly connect. And that's hard because we can't knock on the doors with COVID-19, right? So how do we really, and this brings those disparities even more to the surface, that I just believe that there are still people that we're missing. And I'm really challenged and still really praying and trying to figure out, how do we capture those who I feel just might just be falling through those gaps?
Okay. Well, my hope is that the DC chapter of the Association of Black Psychologists, by having this conversation, will create a message that can go out and be informative and transformative in making people aware of the questions, the issues, the challenges that you and others have kind of shared. So at this point, I want to kind of turn to, I have a couple of questions that have been posted on the chat box. And let me just go back up, find it. Okay. Okay. So this is one of the questions that I have. I'm going to throw this out there, and whoever is interested in responding, feel free. This question comes from Siobhan F. Johnson. Not sure where she's from. It says, what do you think about the 13th Amendment concerning mental health in low-income areas? What do you think about the 13th Amendment concerning mental health in low-income areas? Anyone want to address that?
13th Amendment.
I'll take a start.
Okay.
I would say the 13th Amendment, just like the movie 13 shows, that once again, our country is built upon certain values and belief systems that were not meant to see us and treat us and acknowledge our humanity. And the 13th Amendment is a perfect example. It's the one where there's a clause still in there that allows, that has led to the massive incarceration of our folk. And more specifically, when our folk do need some spiritual support, and I say it's that before it's called this thing mental illness, right? There's a spiritual soul woundness that many of us are carrying around from generation to generation that is a direct result of unresolved grief, trauma, from the continual perpetual exposure to racism, systemic racism and systemic oppression. But to the caller's question, I say that is what's promoting it. They're actually turning the incarceration of our folks as the primary first response to mental health needs. You know, so they're criminalizing our needs and our psychological and emotional needs because the behavior is a manifestation of that. So I'll step back and say we have to continue to lock arms with Congressional Black Caucus and every other and hold our elected officials accountable to our communities to shift this, again, to make sure that our rights and our voices are being adhered to, but we cannot do that until we, I have to go back, until we do it collectively. It can't be just pockets of us. When all Blacks around the world decide to lock their arms and have each other's backs, then we'll have the force to push the changes through everywhere we need them.
Okay, and just for those who may not be that familiar, I always keep this handy, Constitution. But the 13th Amendment passed by Congress January 31st, 1865, ratified December 6, 1865. It says, neither slavery nor involuntary servitude, except as a punishment for crime, whereof the party shall have been duly convicted, shall exist within the United States or any place subject to their jurisdiction. And in many instances, that can be pretty much kind of, you can infer from that you're free until you're incarcerated. And then once you're incarcerated, all bets are off. And so this is why it's been important for ABPsi to deal with the school to prison pipeline, to begin to create programs that do not underestimate what we bring to the table, to inform them culturally how to effectively engage us and teach us, as opposed to labeling us, so that we can move through the educational process to acquire some means by which to employ ourselves so that we can overcome the low wealth status that's been a part of institutional or systemic racism that oftentimes leads to incarceration, oftentimes for non-criminal offenses.
So Dr. Cook, if I can add too, because I want to follow the beautiful modeling that Dr. Filia did and say at this level. If first and foremost, if 4% of all psychologists are people of African ancestry or Black, even less of them are members of the Association of Black Psychologists. Mm-hmm. Less of that 4% is even aware that something called Black psychology exists and the scholarship within it. I say that to say that we are a small group carrying a heavy load. And our proverb says, many hands makes a light lift. And so as the callers are listening to all the aspirational things that we are intending to do and the real things that we're doing, I want to put that into perspective too. And more importantly, we are experiencing the exact same exposure to systemic racism and oppression as the communities that we're trying to help. We are of that community. We are the same. So I'm saying to say that we do need to have more members, more affiliation to address the global and complex needs of our people in general. You do not have to be a psychologist to be a member of the association, but you do need to be very grounded in Black psychology. So for any of the colleagues who are listening in mental health or any other space, if you identify as of African ancestry, why not be part of this association? Why not critically consider the scholarship of Black psychology for its application in your work? Because then the kinds of questions that our folks are bringing to us, like this one around 13, we will have the people power to make even deeper, genuine change and have the answers for our folks. So we have to do this together and not for our people, but with our people.
Very true. Did anyone else on the panel want to address that? Okay, go ahead.
I just have one comment. I know in order to get my doctorate, I had to, of course, do a clinical internship, and my clinical internship was in the federal prison system. And it wasn't until then that I recognized, that I realized, and I was definitely a very young and inexperienced woman back then and didn't understand how deep this whole racism thing went, even during that stage. But it was disheartening to find out that, yes, all the men that I was working with were basically pressed into servitude. They were definitely slaves. And being on the inside for that year, I saw it every day, and it was completely disheartening. Like, we can watch, things on TV about lockup and all of that, but a lot of people have no idea how real the slave system is inside those prison walls. And I thought that was going to be my career path, to work with our men and to make sure that they're okay when they got out. But rehabilitation is absolutely not the goal. And it really is all about punishment and servitude and releasing them in a worse situation than they were in, before they got there. So we can't ignore what happens when our men and women go to prison, because we are definitely experiencing them having to go into slavery and being forever changed because of it.
Okay, just an update real quick. Dr. Fiambalashaka, there's a major thunderstorm going through this area. I'm in Virginia, so it's coming this way. But her Wi-Fi got knocked out due to the storm. And also with Garrick, I think he just came back, but I think some are facing that. And so that's something that we just need to let the audience be aware of. If all of a sudden the screen goes, it's not because we checked out early, it's that the storm did it for us. But I think we've been really moving on the conversation in a way that I think has been very helpful. So let me just ask this question as we kind of round off this conversation that we're having. And the question is, what kind of mental health reforms are necessary to better serve the Black community? And so I would like to start this off with you, Dr. Theopia Jackson, in terms of what your thoughts are around this particular question. What kind of mental health reforms are necessary to better serve the Black community?
Okay, thank you. First, I want to remind the audience that Black mental health, or just let me take mental health in Western society, is predicated first and foremost on this idea of treating the individual, and it's predicated on the idea of identifying the problem and correcting the problem. That's not true for all, but that's the general infrastructure. And right there lies some of the problems, because many people of color, and particularly Black folks, are more community, more connected. And so our healing comes in community with one another as opposed to being in isolation. I'm reminded of a story that was shared with me in South Africa, because of course, we do our business of imposing our psychology around the world. So in this South African village, they were bringing in therapists who were meeting with the villagers one-to-one. And one of the villagers said, I don't understand, why would I go into a dark room away from the light of the sun to sit with one person as opposed to sitting with my village around my issues. And so that's a clear reminder that we must look at multiple ways in which this healing can happen, and also critique what is therapy, because not all therapies are therapeutic, and not all that's therapeutic is therapy. And some of the therapies that our people have been trained in, those tools, do not work for us at minimal. At worst, they actually socialize us further into being clients. So I just wanted to say that for the context of how I'm going to answer the question about strategic things moving forward. First and foremost, we must generate not only a stronger Black workforce going beyond that 4%, but I'm going to use the words from our youth, a woke Black force. who have been exposed to the scholarship and literature, so their genius Black minds can interrogate it and figure out what's working, what else is needed, and to move this forward. And here's why I give a shout out to Dr. Savage, as one of our past presidents, who actually launched this in terms of, the Association of Black Psychologists putting together a certification program around African and Black psychology. So that's one initiative that we are doing that we want to add to others. However, with my presidency, though, I'm realizing that in addition to having the certification in African Black psychology, which is for us and by us, we do need to create something for our non-Black allies. First and foremost, going back to the stats, it's because the majority of them are the ones who are seeing our people, and we can't afford to have anyone be a casualty of war. So we have to help share because we know what does work. We have to also translate what part we can to our non-Black allies to do the work that they're doing. So that's one piece. The other one I want to say too, as an example around this, Dr. Streeter and others have shared this, particularly Dr. Savage's work. We have to have more programs around the country that are grounded in Black psychology and African center. I am blessed to say that with one of my jegnas, Dr. Wade Nobles, we were able to, with others, with the Bay Area chapter, the Association of Black Psychologists, launch something called the Therapist in Residency, which in fact was just this. What does a clinical training program look like that's grounded in Black psychology, where the staff is Black, supervising Blacks who are going into the community to provide services. And I'll just give you one example of what this might look like in a different practice way. So because we're very clear that we too are of the community, we do not call it therapy. It's referenced as courageous healing conversations that we're having with the quote clients. I say quote because we've changed the languaging and let go of the word client and recaptured African language to say Bwana Umbuti, which is an African term that means child of my ancestor. And we have let go of the term therapist or therapist in training and adopted the African term of Nganga, which is a healer. So if you can just see in that conceptualization, a healer is having a courageous healing conversation with their family member. I'll just use that as one example of how we can put this in place. A second level, I would say, would be a shift in paradigm within the American Psychological Association and other entities that have oversight for mental health training and care. And what I mean by that, again, is they have to do a deeper dive to really do a self-examination. How has systemic oppression and racism informed this system? If they do that, then it will lead to effective change. And an example of this would be, I still have not seen the American Psychological Association address the psychological damage that was done to those who perpetuated all the ills against us. There's something wrong with that psyche. And I think they need to bring their best minds to understand, diagnose, and define that problem and bring out the treatment. When they do that, then anti-racism will be a reality and not an aspiration. And therefore our humanity will be protected in that sense. I also want to say too, this shift needs to happen within American Psychological Association, where it strategically says, how do we bring in all of the critical literature on psychology, regardless of who it's coming from, to sit at the table along with all the quote giants that have been deemed by APA. perfect example, Black psychology should be at the same table in every APA accredited program so that everyone has to critically examine it, see its relativeness, so that our Black minds who are going through these programs see themselves in the writing. They will find words to what they've been feeling in their spirits and what they're seeing. And then lastly, I would say too, when I think about what I would be asking of institutions like the American Psychological Association, is you have to band together and critically get rid of this thing called the DSM, which is the Diagnostic Statistical Measures, because it was not made with our experiences in mind. You are theorizing and diagnosing our behaviors, which are a direct result of this persistent systemic racism and oppression that we've had to endure for centuries. And so we need an entirely new nosology, which again, some of our Black minds are starting to do, but APA needs to follow that lead too. My third point, you can tell I've been thinking about this, right? My third point is, as I've alluded to earlier, we have to critique what we mean by therapy and instead embrace a more healing approach. Because if we embrace healing, then we recognize that there are many grassroots organizations and places who are doing good healing work, that where people do not need something called systemic therapy unless they're working with what our sisters have already, and what Dr. Savage and others have already said, the right therapy. But before there is this quote organized therapy, there should be healing places like the Emotional Emancipation Circle and other things that are already grassroots. And how do we get more funding, more access, more population so that our folks know that it's there as opposed to discovering it? And my last one, I'm almost done, I promise you, is how do we, again, help our people become good consumers of these systems so they are leveraging their collective power in making sure they're getting the right services that they need? How do we, because in doing so, it will break down some of the barriers that Dr. Streeter and others talked about trying to be able to access them. So an example of this would be, I'll give you two questions. I would ask our people to let go of, do you have any Black therapists? Please let that word go, let that phrase go. Expand it instead and say, do you have, let me back it up. How does what you're about to give me treat or address systemic racism and oppression that's gone untreated in my world? How does the behaviors and the symptoms that I do in question mark that I'm presenting with now, what might that have to do with the unresolved treatment and exposure to systemic racism? And how do you have Black folks who are grounded in how to work with me from our African-centered place? So those would be my 4 points for moving forward.
Okay, let me kind of shift this again. Earlier, before we started, Facebook audience, our president, Dr. Theopia Jackson, mentioned there was a video that you had, and I don't know if that's something that could be put in at this point, or would that be too complicated?
It should be. Let me just, if you can let our next panelist speak, I will make sure that Dr. Patricia Lundley is coming in to Zoom,
yeah.
so
she
can
got
share
time.
it with
I just
us.
want to make you aware of that.
Perfect, thank you.
As we move forward, because we're doing really great on time. Okay, moving forward, as I indicated, the question is, what kind of mental health reforms are necessary to better serve or provide healing for the Black community? And this now goes to you, Dr. James Savage, Jr.
Dr. Benson Cook, I did want to introduce my new book called Illumination.
All right.
Prescriptions for dealing with the 3 blind mice, mental illness, miseducation, and poverty.
Okay.
And in this book, I'm talking about—
You hold it up a little more so we can see it. All right, okay. Oh, okay.
Okay, you see it? Okay.
Yeah.
And within this book, I'm talking about the new, my approach to dealing with what we need to be doing as a Black community is coming up with a Pan-African solution to our problem.
Okay.
Most of our problem has been very endemic, endogenous, right? Very, very, very centralized here. But I think we need to get with our brothers and sisters throughout the diaspora.
Okay.
Right, and begin to forge. I know ABPsi has that as one of its goals, to bring all of our people together. But I think many of us, have forgotten our Pan-African roots. And I think that's, certainly has been more of a harm than a help for us.
Okay.
And so I really want us to begin to move in that direction, to begin to bring our brothers and sisters from all over the world into what we need to do to end what I see as our oppression.
Okay.
Okay. And what I see out there today that's really hurting us as a people here in America is a concept that is related to a French term, but it's psychiatric in nature, psychological in nature, called folie à dos. That's FOLIEADEUX.
Okay, and so for our audience, explain for our audience.
I will. This is called shared psychosis. And we can see that happening at various levels of our society.
Okay.
Where the blind is leading the blind. One mentally ill person leading other mentally ill people, right? That, and that can happen with such as in a police force. Okay. And we can end up with the kind of violence that we see coming from, police, right? It can happen in other strata of our society. Okay. And we need to begin to address that as a real problem for people of color. Okay. It is a real problem for people of color, this shared madness, this shared psychosis that's operating in our society.
Got it. Okay, moving forward, Dr. Satara Streeter, what kind of mental health reforms do you see as necessary to better serve the Black community to create a healing environment?
Hey, thank you for that question. One thing that I think needs to happen on a larger scale is this whole issues with even individuals that have insurance, that have health insurance. Sometimes they have huge co-pays or huge deductibles that prevent them from getting the mental health help that they need. At our office, it doesn't matter because we see people regardless of their ability to pay. But for some that still need this help, I think it would be, one reform is making sure we get rid of co-pays and deductibles for mental health because it is, so important. Without good mental health, it's nearly impossible to have good financial health, social health, relationship health. Is kind of the core. So that's something sweeping that needs to be done. But on another scale, I think there needs to be more money for African-American students that are interested in going into this work, to work with African-American communities. There needs to be more money for them to go to graduate programs that actually get it, that are going to teach them what they need to be taught in order to help their community. Another thing that I think is huge is the licensing mandates. When there are so many good therapists that I know that can't get licensed because, it's almost like what Elder Williams talked about when he did his assessment test. When you test people on things that's just not relevant to them, then it's hard for them to be able to get, to have success. So I think the licensing mandates that we have now for individuals that are wishing to go into psychology are just not designed to really allow African Americans who want to work with African American populations to really sit in the room. Another thing that has to happen somewhere, this whole notion of empirically validated treatment, that's literally code word for I want you to do the treatment that we as white folks have decided works for our folks. So you guys need to learn it and do it. And that's how you do the insurance billing, saying that you've done what we want you to do. And that's really hard when we think about that these are the same folks that oppress us and cause a lot of the mental health issues that we have. So now we're supposed to look to them to come up with the treatment that's going to help us. It just doesn't work like that. And lastly is I think there should be, and I know Dr. Jackson and I have talked about this before, but these mandatory partnerships with organizations like ABPsi, so with people that are non-white or call themselves allies, if they want to work with our people, they should have to come to us or others to get the help that they need to be able to do that and stop causing harm and actually start helping the individuals that seek their help.
Makes sense. I agree. Definitely. Dr. Fiambalashaka, you're back. The question that we had put up is, what kind of mental health reforms are necessary to better serve the Black community?
Say that one more time.
Okay. What kind of mental health reforms are necessary to better serve the Black community or create healing? What kind of reforms?
Okay. I definitely want to support what I heard some of Dr. Streeter saying in terms of the money behind it. It's too expensive for clients to have access to mental health services. I watched, I don't know if you all watched the show Patriot Acts on Netflix, but there was a really good episode on mental health and how horrible, terrible, awful insurance is in terms of certain locations that you live in. Just, I think like psychiatrists being like 300 miles away, the closest one, and everybody's booked. I know for me, like Dr. Streeter was saying, there needs to be way more mental health professionals. Now I'm mindful that, right, everybody should be good professionals and well-trained. But as I was saying earlier, I've been facing the concept of being booked and busy. I'm always booked. I have not had an open schedule since 2019. And I only slip people in every now and then. So, but it's speaking to not having enough access to well-trained people. So I think the programs really need to change. I think even in getting a licensure, I remember for New York, they asked if I had ever taken a class on culture, and my license got denied initially because at Howard, there was never a course that said culture in the title. Mm-hmm. And so it got rejected, my application. And so Howard had to like write a letter on my behalf to justify that culture is not one class, it's embedded into every single class. Yeah. And so I think that the education of therapists really needs to change. I know for Garrick, a student at the Chicago school, that he started even an organization to address some of the needs of the student. So what is it called, Garrick? The minority something.
Yeah. The Minority Initiative. It's a student organization at my school.
Yeah, so the Minority Initiative, which is a student-based organization, so it's really frustrating and disappointing that the faculty didn't necessarily initiate that. So it's oftentimes students even articulating they're not getting enough of what they need. So I'm getting called in to do guest lectures often at other universities because they haven't hired faculty who have expertise in Black mental health. And so just to even recognize that should be core to licensure, to training, that having special courses and things should be required. So I'm just thinking about even licensure pieces, education pieces, and just insurance and the payment. I really hope that one day therapy can be free for all Black people. So maybe we can do that, Madam President, for one day.
Sure, I've got that taken care of, sister. I'm good. I got you.
We got to add that to the mission statement, not only liberation of African minds, but free therapy through well-trained therapists.
Who can access training at a more reasonable cost, because many of our people are coming in to do the work, but just getting the degree, let alone everything else, is pricing them out.
Exactly.
And we can't afford to do free therapy.
Yeah.
In
many ways, it's like a form of reparations for parts of our community that are low wealth, that have been locked out because of oppression and institutional and systemic racism.
We're going to call it psychological reparations for our people.
Nice.
There you go.
Yes, I'm writing that down too.
I am too. The mandate's been written.
All right. So was that it? I didn't mean to cut you off, Dr. Fiambalashaka.
Yes, it was. I was being conversational, but yes, it was. I felt like I missed so much with the storm, but it passed. Yeah. So I guess that even goes with what Dr. Savage was saying, that this too shall pass.
Yes.
So even electricity, the Wi-Fi was down, but I'm back and even more energized. So
yeah. So Dr. Reverend Anika Wilson Brown, when I ask you this question, I'm thinking of as that bigger picture I kind of spoke to before. It's almost like you're wearing two hats. On the one hand, you're wearing the hat of your training on one hand in the ministry, and the other hand, the training as a mental health clinician. And in that context, what kind of mental health reforms do you think are necessary to better serve? But what kind of reforms do you think would enhance the critical role that the Black church has and continues to play?
Thank you. I have to say that I really echo and celebrate what has already been shared. I was just jotting down notes because I think those were powerful messages shared. I think and agree with this notion of redefining what therapy is and expanding that scope to be inclusive of communal modalities, ensuring that we are bringing in spirit. And let me clarify, when I say that, I'm not saying religion. I mean spirit, our African worldview, our African way of viewing things. It makes everything connected and all of us connected and just brings us all on one accord. I think that has to be emphasized and brought back into this. I also think of my great-grandmother, who was a spiritualist, but she also was a healer. So she had to serve in her church, but then she had this, what we call back kitchen religion, where folk would come into her house for the other stuff she had done, if you know what I mean, right? And so she is a woman that I have her on my altar, and I always reference her because I think that there are so many healers in our community, so many that have this intuitive connection and this way of being present, but they don't have the privilege of being in that 4% and sitting in that classroom like us and getting all these student loans that I'm still paying off, right? So it's a privilege. We created this privileged place to be in this position to help and support. But what if we begin to, I'm just using creativity and imagination now, but some kind of way begin to create a path where we begin to empower the healers and we bring the healers forth. And we give them the tools or the training, what's needed, so that it's not based on a westernized paradigm, right? But it goes back to the root of what we have always offered to one another in a genuine way. So that notion of healing spaces just really resonates with me, of how can we create that. When we think of COVID-19 and the impacts that we're going to be seeing coming from this, it's really about the loss of community and the loss of those communal spaces of connection. So I think that is key to reforming mental health practices for us, just tapping back into that culture, that spirit, and those things that initially brought us through, and not forgetting that. And the church has to stop demonizing those ways of being, right? We have to, I heard folks rebuking yoga. I'm like, y'all serious out here rebuking yoga? So, I mean, we have to realign ourselves and just get back into this way of being that connects us to all of those things that are who we are.
Yeah, it's like creating that sense of awareness.
Yeah.
Dr. Cook, can I just add something very quickly after what Dr. Wilson Brown was saying, because it's so powerful. I so appreciate what you're saying, particularly when you made the reference to altars, because what I've also found is that some of our faith-based leaders have forgotten, in that collective cultural way, has forgotten the importance of altars and the importance of acknowledging those who have transitioned and gone on. And instead, they somehow don't recognize it as their own. And I also want to say too, even when we talk about meditation, family, let's be careful here. Western is feeding us back that which was already our own. How do you think our people got through 400 plus years of enslavement? Those songs were not just songs to be fill in the air. They were going into a collective altered state of mind to keep each other up on their feet, to take their minds away from the body of their pains. So meditation is Kemet. It goes back to ancient Egypt. So I do want to celebrate you and say, how can we have these critical conversations so all of our faith-based leaders and all of our, quote, mental health leaders truly understand the centrality of our spiritness and take back all of that which is our own for our own healing.
Reclaim it all, reclaim it all.
Amen again. As Dr. Savage, I want to put this up. This is second edition of a book I had an opportunity to do, all about depression, second edition, issues,
Yes.
resources. And what's important about this is a collaboration of myself, Dr. Skylar Webb, Dr. Thea Mbalashaka, who's here, Dr. Kimberly Bell, Michelle Levere, Drs. Natalie Bazille Johnson and William Talley. What's in everything that you touched on is addressed in that. Again, all about depression, second edition.
Great, fantastic.
Yeah. Now, we have another question from someone from the Facebook, and I want to do this. And after this, then hopefully we'll have time to do the clip. The question is from Jojo Hickson. What advice do you have for scholar activists who are currently engaged in activist activities, work, but feel overwhelmed due to almost daily news of Black people dying and not receiving justice? Again, and this is for any one of the panelists. What advice do you have for a scholar activist who's currently engaged as an activist doing the work, but feeling overwhelmed due to almost daily news of Black people dying and not receiving justice? Whoever would like to take that, please speak.
I'll chime in here. First, thank you for your work, for who the person that wrote that question. Thank you for your dedication to our community. I think that this is, it's important that we have moments where we detach and where we step away from our activism and our movement so that we can create moments of joy and step into something else. And I've been trying to be very intentional about that, even though it is harder and harder these days to just limit my time and exposure, creating those boundaries, creating space for myself, and also taking the weight of all of it off of my shoulders. I think this is why we need multiple leaders. We need people in every lane. You know, I say there are many lanes on Justice Highway. We all have a role to play, right? So that when I get tired and when I have to pull back, there's somebody else forging ahead so that we're not losing ground. So that means letting go of this savior complex that I think many of us take on when we are leaders in the community, because the weight is so heavy and the task is so great. But I would advise that individual to just practice the art of detachment, of stepping back, of disconnecting yourself from those moments, and trust that the divine is moving this thing forward on your behalf, and that your ancestors are pushing it forward. Even when you're tired, it's okay to take a break. It's okay to breathe. You ain't got to fight it all by yourself. And I say that because I say that to myself all the time, because it's heavy. But those moments of refreshing are important. Go to your altar, sit, breathe, and all will be well.
Ashe, Ashe. Did anyone else Did anyone else want to address that from Jojo Hickson? What advice do you have for scholar activists currently engaged in activism work, but overwhelmed due to almost daily news of Black people dying and not receiving justice? Okay, what I'd like to do at this point, Garrick, I'm gonna need your help, is there was a clip that is about 2 minutes long from South Africa. And I don't know if you're ready to play that, and then we'll come back and wrap up.
If I may, Dr. Cook, I'd like to introduce and appreciate one of our other phenomenal scholars and members of the Association of Black Psychologists, Dr. Patricia Lundley, who is out of Oakland and one of our educators training those who are going in to be teachers in the classroom. So Patricia has been graciously accepted my invitation to share this clip with us based on the questions you asked earlier around the police brutality and violence.
Thank you. Okay, I'm gonna get ready to share now.
Yeah, just all you gotta do is click the share screen right in the middle, and then.
Okay, looks okay, so share. It says you've disabled participant screen share. So can you enable it?
Okay. Let me see. Host. Okay, so the host. So manager at abpsi.org, you have to enable that. It's currently.
While they're doing that, Dr. Lundley, do you want to give any context for this?
Yes. So basically, I have had the good fortune to travel to South Africa many, many times, about 7 times. I think that's my home now. And so as a result of that, I bring good news to all of you that our South African brothers and sisters, they are so connected to us, and we are them, they are us. Ubuntu is like, and they care about what's happening, and they're paying really, really close attention. And so as a result of that, I always get updates and news. So I'm gonna see right now if I'm able to share. Okay, still saying I cannot. So this particular clip comes from, I'm gonna spell it, and then I'm going to try to click and say it. It comes from QWA, which is Kwa, I can't get the click right. So Kwa, South Africa. It is a Black township. It's not close to Soweto, which is near Johannesburg. So it's out there, and so you probably don't hear a lot about this place. So this is from an artist, Casey De West, and she's like my adopted South African daughter, and she's an artist. And so this is what they produced for us. So I'm gonna try again to see if I can share the screen now. Yes.
Yeah, Dr. Lundley, you should be good now.
Okay, so hold on just one more second. Sorry, y'all. Okay. So I'm not sharing yet, right?
No, not yet.
Can I see it? Okay, so let me go back, share screen. Okay, so now, okay. Let's see, share. And I want to go
It's coming,
here.
it's coming
You
now.
can all see my screen now, right?
It's coming, yes.
Okay. All right, I want to make sure I got the sound in though. Okay, so here we go. Thank you for your patience. Oh, it's taking a minute to boot up. I am so sorry.
No, that's okay.
Let's
That's okay.
try. As you can see, it's not a long clip, so we're just gonna keep believing.
Maybe try refreshing your screen at the top.
Okay, thank you. All right, just did that. And now let's see. Yes. All right, here we go. Now play.
It sounds like it's on mute somewhere.
You're not hearing it?
No.
No.
Okay. All right, let me try one more thing. I'm so sorry. Thank you again for your patience. Let me go back here and here. Okay, I'm so sorry. Now we can do it. All right, I'll start over with it. Okay, thank you again for your patience. Here we go. That's Casey De West.
Enough, it's enough. Enough, it's enough with the killing. Police in the United States, please stop killing black folks. Please stop killing black folks. As African, we stand with black folks in United States. We say enough is enough.
Hey, chawasaranto. Lona ka America ka mono. Kana le lona. Lona boga sunyana. Ajelemeng ka dipolawa tsa batho ba batsho. Utlwile ke lona. Jale re eme jalo ka setjhaba se setso. Go lekane. Ha e fele taba e.
We're saying Black Lives Matter. Black Lives Matter. Our life do matter. Yebo, my father.
Siyabonga.
Thank you so much for allowing me to share that information. And there's another one that's a little more sacred that I can't share with you. And it actually shows a traditional ritual where they are calling some other spirits to come and do some work for us. So again, we're not a monolithic people, nor are our African people. And so they're doing some other things, calling on the spirits to come and fight for us. So thank you again for allowing me to share those things from South Africa.
But we need a Pan-African, movement. We really need that.
Yes. And thank you, Dr. Cook, for letting us do this, because this too is an example of what ABPsi is doing. We think about the use of technology. We no longer need anyone else to filter our communications with one another. We're able to be in global experience in real time, hear each other, bear witness to each other, collaborate, and work together.
Yes. And this is what we promised, a distinguished panel with some exciting connectivity. Keep the circle unbroken with our South African brothers and sisters. That is very fitting for the discussion that we had today. And this was a powerful discussion. My hope and prayer is that each of you who've been able to witness this on Facebook will continue the conversation with your family members, with your loved ones, with your friends, with your colleagues, in your homes, especially since you can't go out. This is something that hopefully will bring not only an understanding of the reasons why there's a sense of urgency, but more important, an understanding of the solutions that can be put forward, as the distinguished members of this panel have done. So we've come to the end of our program, and I want to give a very, very warm thank you to you, Dr. Ethiopia Jackson, to you, Dr. James Savage Jr., to you, Dr. Afia Mbalashaka, to you, Dr. Satara Streeter, and to you, the Reverend Dr. Anika Wilson Brown. Thank you all so much. It's been an honor to be able to moderate this panel. Thank you. On behalf of the DC chapter of ABPsi.
And thank you to you as well, Dr. Cook. Akshe, and blessings to all.
Thank you.
Okay, thank you. And goodbye. Gary, sign us off.
But do you want us to stay on the Zoom when we stop the
yeah, if we could stay on Zoom for a minute, those of us who presented while they